Why begins with triage? There may be other ways to consider ethics in disasters. For example, applying ethical theories, utilitarian, egalitarian, deontological, to emergency cases. Here the method is to pay attention to the widely accepted ethical principle and intuition appearing in the act of triage, maybe the act conducted in a situation of a disaster. By examining the act of triage, we find the principle of utility. Moreover, we realize the primitive desire and response are at the base of the act, from which we can construct ethics in disasters. What is triage? Triage is a medical assessment of patients to determine the priority for treatment and transportation based on the severity of their medical conditions in a situation where medical resources are limited and answering the needs of all the patients is impossible. Triage takes place in urgent circumstances, such as battlefronts, disasters, and emergency hospitals. When medical professionals perform triage in disasters or emergency hospitals, they prioritize the severely wounded patients who are likely to survive. According to the triage used in an accident, victims are evaluated and assigned to one of the following four categories. Deceased or expectant, black. Dead or respiratory arrest. Immediate, red. Life-threatening injuries. Delayed, yellow. Non-life-threatening injuries. Walking wounded or minor, green tag. Minor injuries. Any patient who is not breathing after opening the airway is classified as deceased and given a black tag. No further interventions or therapies are attempted on deceased patients until all other patients have been treated. Patients who are breathing and have any of the following conditions are classified as immediate respiratory rate and responsible. And all other patients are classified as delayed or minor. And this is a triage tag of Kumamoto State. Now I have one. But this is a real triage tag. This is a carbon copy. And a green one, if the patient is regarded as yellow, then it was taken away, and red and black. Triage and its ethical base. One of the ethical principles working at triage is a utilitarian principle. Maybe the greatest happiness. Happiness is survival of the greatest number. However, what is at the base of triage is not the greatest happiness of the community or society. Rather, it is a response of rescue experts to the primitive desire of self-preservation of each wounded person. They try to save as many lives as they can. In this way, as a moment of disasters, primitive aspect of human being, namely desire of self-preservation, often appears. It is my question. So, in this case, utilitarian principle is applied, but we can see the more basic level in triage. So it's a basic level of primitive desire of self-preservation. Though triage is usually regulated by rules made by the government, the rule itself is fundamentally not justified by the agreement among people, but justified by our ethically primitive intuition. Namely, we should respond to the primitive desire of the wounded as far as possible. However, in the act of triage, ethics in ordinary situations, namely equality, autonomy, dignity, are respected as far as possible. For example, ethics of healthcare disaster preparedness states, as medical ethics in disasters, fairness, respect for persons, solidarity, and limiting harm. This shows the difference between the state of disaster and the state of nature in social contract theory. Most of you know the social contract theory. According to John Locke, even after the establishment of a society, the state of nature can appear if a robber endangers others' life. There occurs a state of nature, or more correctly, state of war, where, because of the lack of the power of the government, everyone can appeal to the power to solve the conflicts, and the endangered man can kill the robber. At any moment, an ordinary situation may change to the disaster situation in which resources are lacking, but ethics in ordinary situations should be respected in such a case. And what is ethics in disasters? 3 phases of disaster ethics. One is before disaster, prevention, education, etc., and in disaster. So dilemmas of a conflict occurs. So self-preserve, saving lives, triage. And after disaster, restoration, caring victims, district justice. So disaster ethics has 3 phases. And ethics in ordinary situation applies to before disaster and after disaster. But ethics in disasters in this presentation applies here. Ethical principles for rescue experts. Ethical principles that deduced from ethics in triage. Here, the primitive desire of self-preservation is essential for not only those who need help, but also for rescue members. So A1, within one's power, it is one's duty to save as many lives as possible. And B, one should respect fairness, human rights, and limiting harm as far as possible. A1 is a utilitarian principle stated in a generalized manner. In the case of triage, as stated above, that the criteria of the priority for treatment and transportation is based only on the severity of their medical conditions is argued. In A1, as in triage, it is not ethically permissible to give a priority to family members who are close friends of the rescued experts. Primitive desire of self-preservation and primitive response to the request of the loved. In the case of real danger, it is not unnecessary to abandon other people for the sake of escaping death. In that case also, we have to respect fairness, human rights, and limiting harm. However, we have to distinguish between family members, close friends, namely those who are loved by us and others. When escaping from a disaster, to save others is desirable, but not duty or obligation, because duty of saving others puts too much burden. On the other hand, to save family members and those who one loves is an obligation, though within one's power. As stated before in triage, so yeah, I skip. Ethical principles. In the case of saving people other than family members, ethical principles for those escaping a disaster, not so disaster rescue expert. Saving people other than family members and so on, within one's power, it is desirable to save the lives of other people. And B is the same. In the case of saving family members and or those who one loves, S3, within one's power, one should save their lives. B is the same. Application to some conflict, cases of conflict, or cases of dilemmas. Earthquake, the tsunami will come in 10 minutes, begin to escape. But worry about the old women living alone nearby. What should we do? The case of A2, judge immediately if it is within our power or not. And the second is earthquake and tsunami warning. Around 40 minutes tsunami will come. In 10 minutes, reach the safe place, but one family is missing. The case of A2, the same. It seems within our power, so returning is desired, but remaining there is also permissible. Also, earthquake and tsunami warning. I'm a rescue expert. They are the same situation. So the case of A1, it seems within my power, so I should return. When we transport wounded to the hospital, a press cameraman tried to take a picture of him or her. What should we do? The case of B. Even in a disaster, we should respect patient privacy. And natural feelings and moral sentiments. I proposed, in the case of saving family members and those who one loves, S3, it may be objected that in that case the expression should is not suitable because as love is not duty but feeling, saving the loved one is a matter of feeling. Here it may be helpful to refer to the phrases of R.M. Hare. Hare's sentence. To take a pasteboard example with which I was once confronted by Professor Bernard Williams, you are in air crash and the aircraft catches fire, but you have managed to get out. In the burning plane are, among others, your son and a distinguished surgeon who could save many injured passengers' lives. To say nothing of those whose lives he would save in his subsequent career, you have time to rescue only one person. So your son or dismissed surgeon. Here continues. However, setting aside all these minor points, we find that you have a very strong feeling that you ought to rescue your son and let the surgeon burn. You almost certainly will rescue your son, but that is because you have been brought up to attach dominant importance to these family loyalties. Your intuitions were simply not designed to cope with it. However, you do have the strong moral feelings. So you ought to rescue, but you have strong moral feelings. And will probably act on them in the split second, which is all you have to decide. Here refers to feeling or moral feeling, which works as a base of the act in emergency. Moreover, according to here, this feeling is to be trained, namely moral feeling. However, is moral feeling the base of our act in emergency or act in a disaster? In air crash case, another example, so it's my example. If you and your son hate each other and in a plane, instead of the surgeon, there is a person you deeply love, which do you rescue? In a split-second decision, you might give a priority to the loved one rather than your son. You might. You act on natural feeling, but you probably will be blamed ethically. Natural feeling seems to lie on more basic level than moral feeling. Natural feeling, so what's the base of the moral feeling? That is the level of natural feeling. I proposed, in the case of saving family members and or those who one loves, A3, in considering the case where family members and loved people are not the same, we find more basic. In the case of saving those who one loves, for within one's power, one is obliged to save their lives. Ethical principles in disasters. So I summarize that. So A1 and AB and A2, A3, A4. So they are the ethical principles in disasters. And obligation and feeling. For within one's power, one is obliged to save their lives. What is that obligation? This implies a kind of necessity. So there is obligation, then where there is obligation, then there is necessity. Necessity of natural feeling, and also this necessity is closely connected with ethical necessity. When one cannot save the life of the loved person in a critical situation, one often feels remorse and regret. Remorse doesn't occur if one cannot eat bread one strongly wanted to eat. Here we can see the delicate relationship between ethical and natural value and act. And so David causation, so I have to skip this because of the time. Yes. So ethics in underwriting. So this is the figure of the summary in ordinary situation. Ethics in triage I first considered, and from this I applied. So I deduced A1 duty to save as many others as possible, utilitarian. And then A2, encourage saving others within one's power. And A3, obligation to save family or loved within one's power. And then pre-ethical obligation and feeling. So this is ethics in disasters. Ordinary ethics in the background. And at the base of the ethics of disasters, we find that the primitive desire of self-preservation and the primitive response to the love. And about the pre-ethical obligation and feeling, it's a natural necessity. It's a place of natural necessity and also necessity of feeling. These are ethical level, and the two are pre-ethical level. And utilitarianism or social contact theory from pre-ethical to the ethics in ordinary situation. We can also deduce, or we can get the ethics in ordinary situation from pre-ethical level, namely primitive desire of self-preservation, primitive response to the loved is the base of ethics in ordinary situation. Thank you very much.
Please questions. comment that I will tell you from my students. You mentioned utilitarianism, but patients who have a severe condition, usually their treatment is very resource intensive. So in fact, you will spend a lot of time on a patient in a severe condition, and so you cannot make many people happy. So I think it's not utilitarianism, it's about vulnerability, that patients who are the most vulnerable get priority over those who are less vulnerable. But in the end, you may end up making fewer people happy. But of course, from the standpoint of not doing futile treatment, futility in a case that the patient is probably already dead and you don't have to spend time on something that could be futile, that could be, you know. And the comment from my students, you know, I had American students who strongly said that they would spend time on their loved ones, and they told me, how is it possible that, you know, when I act on love, it is not ethical. They said, it's my responsibility to act on my love to my family, to my relatives, and to friends I love more than others. And I couldn't convince them that, you know, you have to be fair. They said, my ethical responsibility to act on the love I have to these people. So, thank you.
Thank you very much. One question is, in the situation of patient condition is similar, so it is not the case of applying triage, because triage is applied when the conditions of illness or is different, so we can distinguish which has the priority, but they are the same, so we can decide by triage rule. And so it has similar questions raised about the within the red tag, which have priority. It's the same. So we have to apply another principle. Namely, for example, principle of one is you mentioned vulnerable persons have priority, or the person whose social status is high has a priority, or the person who is young and has family. And so on. And I was act on my love. So this is this point. My point is to distinguish that several cases. One is one is ethical principles for rescue members, and the other is for the people who are running from a disaster. Well, a disaster is natural or man-made, including terrorism. And so the third one is ethical principles or primitive principles for the person who are running and have to save families or the person who is loved. So So your question is about the third principle, and triage is the first principle. Okay. Thank you.
Yes, another questions?
I just have one comment to report from a comment from Hassan Urbay from Turkey. He was here last year, and you missed in Manila. Some of us were there. He gave an interesting presentation on who gets the ambulance first, based on his experience in Turkey, and he was commending your talk here, and saying also that in Turkey the choices are affected by individual characteristics of the care providers. And different attitudes do affect the real practice of ambulance care in Turkey as well.
Any more questions? Well, no questions.